Hi there, welcome to Dr. Chan's Manor Ailment Forum, and today I would like to spend a few minutes to talk about something that I see all the time in the surgery, which is tired all the time. So personally speaking, I'm tired all the time, but I think it's just because I work too much. But there are loads of other reasons why people feel tired, and it's important that you should come and have a chat with your GPs if you have these kind of symptoms, because quite a lot of time is, treatable, and if you leave it, then it will affect your life and work, which is not worth it really. Okay, so let's talk about how people normally come up and say they're tired, and how we kind of do a work down to find out what causes his or her tiredness. Okay, so quite a lot of people, feel tired all the time, but they think, yeah, I think I just work too much, or I don't sleep enough. But sometimes they try. For example, they try to sleep a bit more, improve their lifestyle, take a holiday, and they still feel absolutely shattered. When they go to bed, they don't feel refreshed. So they thought, well, it's time to come and have a chat with the GP to see if we can do anything. So first of all, we kind of have to think about, let's just say there's several different causes of tired all the time, which are organic, which means that it's something change in our body that causing these tiredness. For example, lacking in some certain chemicals. For example, if you're anemic, if you're lacking in iron, sometimes not just iron, but lacking in B12 or folate. These chemicals actually help to make the red blood cells. So you can imagine if you're lacking in these sort of chemicals, and the blood might be affected, you might get anemic. So if you don't have enough red blood cells to collect the oxygen to go around the body, you will generally feel tired. So there's no harm doing some blood tests to see if you are anemic or lacking in these sort of chemicals. And most of the time that the people are tired all the time, it could be related to the diet though, because let's say if you're vegan or vegetarian, or you don't eat very well, don't eat regularly, or if you drink quite a lot of alcohol, the B12, iron and folate can easily be affected because your body are not absorbing it. So in this sort of situation, I highly recommend having a blood test done to see what is going on. So let's just say if you had a blood test done for that, they're absolutely normal. What else could that be? So the next thing that we're going to think about is, are there something else going on? For example, if you're low in thyroid, or if you're diabetic, these two things can also cause tired all the time. So once again, if we're doing blood tests for the B12, folate and iron, or the full blood count, we'll generally do the thyroid, and also to check whether you're diabetic as well, just to make sure that these are not the causes for your tiredness. And sometimes it's quite interesting, all these blood tests come back normal, and it's still feeling tired all the time. Then you kind of want to ask about the sleeping pattern a little bit, because some people do describe, I go to bed, I wake up, I don't feel refreshed whatsoever, but I've been sleeping for 12 hours, so what is going on? So then you might want to get some collateral story or story from the patient. Was there any disturbance during the sleep? Was the breathing okay? Because in some situations, for example, people who have sleep apnea, what would happen is during the night they go to bed, they're tired, and halfway through the night they suddenly stop breathing for a few seconds because of obstruction of the airway and whatnot, caused by so many different reasons. And because of that a few seconds pause of oxygen going into your brain, it can cause a constant tiredness. And of course, there are other causes of tired all the time. For example, celiac disease, which is gluten allergies, that causes you not to absorb your food properly, and hence lacking of some nutrients that will also make you feel tired. But let's just talk about, I'll do a separate topic on celiac, because I think that's quite a major topic to talk about. But let's just talk about something non-organic, as in psychologically, people who are, for example, depressed or having any stress in their life, they would also feel tired too. And it's important to think about things in a broader sense, in a kind of laterally, because let's just say a patient come in, did all these blood tests, everything is normal, absorption is good, diet is good, sleep alright, no sleep apnea, then you might want to think about, you know, is that person okay mentally? Are they happy? Are they actually stressed out, or are they depressed? Because funny enough, depression doesn't always present as feeling low or tearful, you know, the stereotypical thought when people think about people are depressed. But actually, they might just present as having really poor sleep and maybe going to bed and keep on waking up during the night, or really want to sleep but stay awake all night rather. So I think it's important to kind of, when we see a patient with tired all the time, we have to think about every single avenues, because there's so many different causes for tired all the time. So I would say, if you feel that you are feeling tired all the time, and you've tried everything to kind of improve your lifestyle, go to bed early, have more rest, eat better, and it's still not making any changes, I think it's very important for you to book an appointment with your GP, just to have a chat and see if there's any investigations that we can do. Because it's not just affecting you, it will affect your life, your work, your schooling, everything. So, you know, the sooner you get it sorted out, the better, really. So by all means, you know, send us some suggestion of what other topics you would like to hear, so that we can, you know, educate the community further. But for now, that's all about tired all the time, and I would do separate topics or separate videos on the things that I mentioned earlier on. For example, we'll do one for anemia, we'll do one for celiac, and we'll do one on sleep apnea. So just to give you more information, this is just a broad view of tired all the time and what causes there could be. Okay, so take care for now, and see you soon. Bye bye.